Chị hỏi à, nhớ. Okay. 係啊，OK OK，可以啦，OK，好，好啦。
今日歡迎各位記者咧嚟到呢個20。
Welcome to the press conference of COVID-19 vaccination program. We have with us Mr. Patrick Nip from the Civil Service Bureau, Professor Sophia Chen from the Food and Health Bureau, Dr. Constance Chen from the Department of Health, and Dr. Kong Nico from the Hospital Authority, Mr. Victor Lam from the Government Office of Government Chief Information, as well as Mr. Emma Chen of Director of General Grades. We'll first hear from the Secretary, Professor Chen. Friends from the media, Hong Kong people, after fighting the epidemic for 1 year, we have now reached a critical time. Very soon, there will be the arrival of COVID-19 vaccines. We can start the vaccination program. COVID-19 pandemic has brought unprecedented challenges to the entire world. According to the World Health Organization, WHO, as well as health experts, that COVID-19 will not disappear before there is effective treatment as well as vaccines available. Safe and effective COVID-19 vaccination will provide protection from transmission to a certain extent. It will also minimize the damage to the health of infected persons. It is one of the most important measures to protect public health and our healthcare system, which is on the verge of reaching full capacity. The vaccines will also give us hope to return to normal lives. For quite some time, people have been awaiting eagerly for the vaccines. At the same time, there are doubts. I am the Secretary for Food and Health. I would like to send a clear message to everyone. All COVID-19 vaccines authorized by the government for emergency use have been assessed by experts to be safe, effective, with quality assurance, as well as showing that the benefit. We still need further studies and observations on the effectiveness of the vaccine to stop transmission. But what we can be sure is that for individuals, especially those in priority groups, vaccination is better than no vaccination. And for the society as a whole, the more people that are vaccinated, the better, because the healthcare system will keep its integrity and society can resume normal. And it will also give us a better foundation to negotiate opening borders with other places. Thank you. We will now hear from the Secretary for Civil Service. I will now give you information about the details of COVID-19 vaccination program. As Professor Chen said, that we have been fighting the epidemic for 1 year. We have adopted a strategy to prevent imported cases and to stop the transmission inside Hong Kong, aiming to achieve zero infection. We have been enhancing and expediting various anti-epidemic measures. Although there are signs that the epidemic is subsiding. However, we should not let our guard down. We need to get vaccinated. All of us should get vaccinated to protect ourselves and to protect others in order to ride out this storm. Why is this so important? There are 4 points. First, to protect yourself. The vaccination will stimulate immunocytes to produce antibodies to fight the virus. It will also minimize the chance of serious infection. We need to protect our families and friends. Vaccination can slow down the transmission rate. Thirdly, to reduce the chance of an outbreak in the community. If there is a sufficient number of people getting vaccinated, there will be herd immunity, which in turn will drive down the chance of community outbreaks. This will protect our healthcare system. If the entire family is vaccinated, then the whole family is protected. The fourth reason is that it will help Hong Kong get out of the epidemic as soon as possible. People don't have to be restricted by various prevention and social distancing measures. Economic activities can resume normal. Our economy can start to recover again. People can also start their normal lives. So, getting vaccinated is the most important of all measures. As soon as vaccines arrive in Hong Kong, we can start the vaccination program. According to prior agreements of procurement, there will be 2 types of vaccines arriving in Hong Kong. The first one is Sinovac vaccines from our country. The first batch, 1 million doses, will arrive in Hong Kong tomorrow afternoon. And Comirnaty from BioNTech, manufactured in Germany, will arrive before the end of this year. The first batch is about 1 million doses. Although we have procured 3 types of vaccines totaling 22.5 million doses, the amount itself is sufficient for vaccination for the entire population. However, since the vaccines will arrive in batches, just like what is happening now, so we have to set up priority groups to enable an orderly vaccination program in phases. Well, there are 2 scientific committees working on categorizing the various priority groups, and they have given their recommendations. Say, for example, priority groups are those who may end in fatality after an infection. The second group are those that who stand a higher risk of an infection, and afterwards they will easily transmit to fragile or weak people. The third group is that they are key workers. Based on the recommendations, we have made arrangements for the following 5 groups to receive vaccinations. First, healthcare staff in the healthcare system, as well as people who are working to fight the epidemic. 2, people who are over the age of 60, or those who accompany people who are over the age of 60, for a maximum of 2 people. The third group are workers in residential care homes for the elderly, as well as those for the disabled. 4, key workers, say, for example, people who are responsible for environmental hygiene, those who are responsible for dealing with sewage, wastes, etc. Or frontline workers who are in contact with the public a lot, say, for example, those from the discipline services, as well as postmen. And the other group is people who work in cross-boundary transportation, ports, as well as boundary points. There are 4 ways to get vaccinated. First, the 29 Community Vaccination Center. 2, private doctors participating in the program. There are over 1,200 of them operating at over 1,500 clinics. The third type are or 18 general outpatient clinics in the hospital authority, 4 residential care homes for the elderly and for the disabled.
We will set up community vaccination center in all 18 districts. Most of them are located in sports centers. The exact locations will be uploaded later to our immunization program thematic website www.covidvaccine.gov.hk. The vaccination centers will have a healthcare staff administering the vaccines for the public. The operators will include hospital authority, Department of Health, medical institutions and organizations, for example, private hospitals, private medical institutions, or medical professions associations, requiring over 1,000 healthcare staff. Over 1,000 civil servants will provide administrative support and management at the vaccination centers. These vaccination centers will be operated for at least 6 months. We will set up a total of 29 vaccination centers, of which 15 of those will be operated by medical facilities, medical associations, and private hospitals. The Hong Kong U Medical School will operate 1 vaccination center. 4 private hospitals will operate vaccination centers in 5 venues within the hospitals. And there will be 7 centers run by the Hospital Authority and 1 run by the Department of Health. Depends on the different arrival time of the vaccines, the quantity, and the immunization progress. We will open these centers in stages. The 29 community vaccination centers, 24 of which will be dedicated for the BioNTech vaccine. 5 will be for the Sinovac vaccine. When the Sinovac vaccines arrive in Hong Kong tomorrow, being properly stored and arranged, from next Tuesday, which is the 23rd of February, we will accept online bookings for immunization and formally kickstart the program. From February 26th, Friday, in 5 community vaccination centers and 18 GOPC operated by HA, we will administer the Sinovac vaccine for the priority groups. In early March, we will arrange the over 1,000 doctors taking part in the vaccination program to administer the Sinovac vaccine for the public. As for the Comirnaty vaccine, as this vaccine has very strict storage on cold chain storage and must be diluted before vaccination, therefore this vaccine will be provided in 24 community vaccination centers for the public. In other words, the Comirnaty vaccine will be mainly provided in the community vaccination centers, and each center will only provide 1 type of vaccines. Let's watch a short video clip on the operation flow.
政府將喺全港18區設立社區疫苗接種中心。
18 vaccination centers were provided by the government for the immunization. The public must make a booking through the 24-hour booking system to set up a time and place for the first and second dose. The elderly can be accompanied by 2 carers. If the chaperone would like to be vaccinated, they can make the bookings together. The webpage will show a successful booking. And you will also receive an SMS notification to properly store your SMS will be shown when getting vaccinated. The elderly and those requiring special assistance can request for booking assistance at post office or at the public housing estate office. At the day of immunization, Please bring your ID card and the proof of being a priority group at the designated type slot at the specified vaccination center, showing the confirmation SMS or a copy of the booking confirmation. And please go to the waiting and info area and read through the relevant flyers, or download a short clip through the QR code, or watch a short video. If you agree to be vaccinated, please tick on the flyer under the consent column. If any questions on the vaccine or the immunization, please make inquiry to our staff. They will also find out any drug allergies or severe allergies effect. While waiting, please bring out your ID card for registration and roll up your sleeves. At the immunization station, the healthcare staff will ask you to put your ID card into a card reader and confirm that you're physically fit to get vaccinated and administer the vaccine with your consent. Upon completion, the healthcare staff will print out a vaccination record, and then you can move to a resting zone. The healthcare staff will check on your condition. If you can leave, you have show no signs of unwell. And please remember your second dose in order for the vaccine to take effect. Before taking the second dose, we will remind you with the SMS. Beside our PEG record, you can also work through the HA Go and the IL Smart app to check your vaccination record. As you can see from the clip, the community vaccination centers will operate for 7 days a week from 8 in the morning to 8 in the evening. Can you hear me? The public must use the online booking system in the dedicated website to choose the vaccine they prefer and to make a booking on the time and location for the first and second dose. Those over 70 can be accompanied by 2 carriers. If you need assistance to make booking, the post office at the public estate office can help. On the day of vaccination, please bring your identity documents and proof of being a priority group. I must stress that if the public get vaccinated at the community vaccination centers or at the general outpatient clinic operated by HA, they must make a booking in advance. The booking system allows us to reserve sufficient vaccine based on the actual bookings to reduce wastage.
For those who are staying in residential care homes, those are for the elderly, or those are for the disabled, as well as nursing homes, there will be outreach teams arranged for vaccinations to be done at where they are staying. We will send letters to these residential care homes to seek the consent of residents at these places. We will first arrange 10 sizable residential care homes to accumulate experience before we expand the scope to others. Once vaccinated, the recipient will receive the vaccination record on paper form, and they may use IM Smart to download the electronic vaccination record. We will closely monitor the actual situation, say for example, supply and vaccination situations, to timely expand the program to those between the age of 16 and 59 with chronic illness, as well as those under the age of 60. We have more or less completed all preparation work. We're ready to start the territory-wide vaccination program. We hope that you are also ready to get vaccinated. You may visit www.covidvaccine.gov.hk to get the information you need. We will all work together, get vaccinated as soon as possible to fight the epidemic. Thank you. Now we will hear from Professor Chan on safety of the vaccine and various matters. Thank you. Just now, Mr. Nip has given you details about the vaccination program. I'll now move on to the procurement as well as authorization for emergency use. Then I will move on to pharmacovigilance as well as the indemnity fund. You may recall in December last year, the government has legislated Prevention and Control of Disease Use of Vaccines CAP 599K, which empowers the Secretary for Food and Health to authorize the use of vaccines in Hong Kong in emergency situations for specified purposes after taking into account objective medical data supplied by an independent advisory panel as well as an authorization by a regulator outside Hong Kong for its use. We have so far procured some vaccines. They are Sinovac, inactivated vaccine from Sinovac, and mRNA vaccines from Fosun Pharma, BioNTech from Germany, as well as a viral vector vaccine of AstraZeneca and University of Oxford. I have authorized the use of BioNTech and Sinovac vaccines for the use in Hong Kong on the 25th of January as well as the 18th of February. We still endeavor to finalize the procurement of vaccines. Supply is tight. We have already ordered 22.5 million doses, but we should not let our guards down, and we should make it our priority to make sure that everything is in place, because there are still challenges in terms of global supply as well as logistics. The developers has been working at full speed to develop COVID vaccines for large-scale use. As a result, safety monitoring post-vaccination is important. The government will vigorously monitor the vaccination as well as the safety and efficacy of the vaccines. For example, we will ask those who have just been inoculated to stay at a designated area for observation for 30 minutes, just in case there is any adverse reaction. Should there be any, they will be properly treated by resident healthcare workers. On the other hand, we will also enhance our surveillance mechanism. We have adopted strategies announced by the WHO to timely investigate and assess adverse events following immunization, potentially rare adverse events or adverse events of special interest, where we will set up a reporting mechanism for healthcare workers as well as those in the pharmaceutical sector to report adverse events as well as events of special interest to us. The Department of Health and the Hong Kong U are working together to actively monitor adverse events. On top of that, we've asked vaccine developers to provide us with vaccine safety information according to the law for us to continuously assess its efficacy as well as risks. We have set up an expert committee on clinical events assessment following COVID-19 immunization. Members comprises experts from pediatrics, pharmacology, hematology, immunology, pharmaceutics, forensic pathology, neurology, and microbiology. Once we receive any report or information in relation to adverse events or events of special interest, the expert committee will immediately conduct an assessment. As Mr. Nip mentioned, recipients of the vaccines will be able to make use of the electronic healthcare sharing system to store the vaccination record electronically. With that informed consent, the information can be shared by private and public healthcare sector to enhance our monitoring system. I'll now move on to the indemnity fund. Vaccines being put to use in Hong Kong has already gone through a vigorous process to ensure the safety from clinical tests. However, the research period of COVID vaccine is much compressed compared to conventional vaccines. So we cannot rule out the possibility of a rare or unforeseeable serious adverse reaction after large-scale vaccination. Well, should there be any unexpected serious adverse events after inoculation, the recipients should get compensation. However, civil litigations may be timely and costly. On top of that, there is also a high degree of uncertainty. The Chief Executive has already announced that an indemnity fund will be set up to handle cases of adverse events. The initial funding will be $1 billion. In relation to the claim period, we will at the moment set it to be within 2 years after the last dose of a vaccine. We will take into account the pattern as well as timing of adverse events in order to review the time for claim. I must emphasize that even if a claimant has obtained damages from the indemnity, obtained compensation from the indemnity fund, their right to claim via civil litigation will not be affected in any way. They can still take out civil litigation against vaccine manufacturers. However, the amount awarded by the indemnity fund will be offset from the amount to be awarded by the court. Details will make an application to the fund estimated on the 26th of February. I'd like to emphasize that all those vaccines that are authorized to be used in Hong Kong are safe, effective, and are covered by health insurance. The benefits outweigh the risk. Vaccination is effectively a vaccination when it should be avoided. Get vaccinated. It is the question. Please identify your organization you represent before you ask questions. Regulators. To start the universal survey, the shows that 5% of the population will get vaccinated by the government claims. And we encourage them to get vaccinated. We consider that as to reason of elected confidence. And for this reluctance resistant to vaccine, we know that we are not much of a immunity, or even multiple ways of the vaccine have been government considered harmful to us. The vaccine will be administered. It is possible to eventually remain complex, but any progress in training, discussion of branding, and development incentive for the candidates to get vaccinated, which remain the question more. Addition for which, examples of the progress recent with the healthcare staff are making sure that the local reputable COVID vaccine and some healthcare staff visiting worry as part of the daily recent health force and ensure vaccination, which may consider compulsory vaccination for the healthcare staff. Thank you for your question. There's a presupposition to get vaccinated. Before being vaccinated, the partner which will decide the informed consent for personal personal possession. For the public health, is absolutely critical. And also there's a practicability perspective. The vaccination of individual for yourself and your loved ones, and also to the society. People are thinking about getting vaccine.
Well, just now Secretary Nip and the Director of Health have alluded to, and also by myself, this COVID-19 vaccine is developed in an unprecedented pace. All around the world, we are still accumulating experience on the application. Therefore, we haven't heard of any civil claims case. We hope, well, in case of any rare or unexpected serious adverse events, we hope the public would not need to go through a complex legal proceedings and to get some timely economic assistance. Thus, when considering the budget for the indemnity fund, we have built in some flexibility. At this stage, in the upcoming Legislative Finance Committee, we will give more details.
Next question. I'm from Hong Kong 01. First of all, about the arrangements. You talk about priority groups. But the first priority group is not the chronically ill. Does it mean that they are not as high risk as those in these jobs? You mean that people who are exposed to high risk are not as vulnerable as the chronically ill? Does it mean that after you have inoculated the priority groups, general public will not be able to get the doses in the first batch? So how many slots are there every day for booking? Apart from online booking, can you do it by phone? Can you make bookings covering all these different locations? For BioNTech and Sinovac, how much is the unit cost of each dose respectively? How much subsidy will be made available for private doctors? How much money will it cost? Well, will Sinovac be used first because it will arrive first? I'll answer questions in relation to arrangements. The 5 priority groups, they will account for 2.45 million people. Sinovac plus Comirnaty, there will be 2 million doses, sufficient for 1 million people on a 2-dose regime. Since we will accord priority to certain groups, we would like to make good use of available vaccines, and we would like to start it as soon as possible. There will be a large number of people eligible, but the fact is that not everyone eligible would like to get vaccinated at the earliest opportunity. So we think it is suitable to start with priority groups first. You mentioned about the chronically ill. For the age group between 16 and 59 who are chronically ill, of course, they need the vaccine. But we at the same time consider that priority should also be given to the elderly. We have to draw a line. Do we draw the line at 70 or 60? Well, for those between 60 and 70, there are about 1 million people. We have drawn reference from the advice of experts on public health. We take into account risks, mortality, fatality. We think that protecting the elderly is more important. So at the outset, we draw the line at 60 and above as the elderly group. They will be given the priority under the inoculation program. Depending on progress, we will make timely adjustments. It is an organic arrangement. We will make adjustments according to the vaccination progress as well as supply. After the elderly group, we will move on to those who are chronically ill, and then we will open the vaccination program to the general public. You may make a booking in the 29 community vaccination center as well as hospital authority general outpatient clinic. You can make use of the online booking system. There will not be any walk-in arrangements. We have to take into account the logistics of transporting vaccines to these locations in accordance with the amount of people that are to be inoculated. There is no telephone booking. Those who are in need, if you need someone to make an online booking for you, apart from turning to your friends and family, you can also go to the estate management office or post office to get help. The community vaccination centers are run by private hospitals or private healthcare organizations. We will pay them by the number of doses, but there is an uncertainty because they don't know how many people will get vaccinated per day at these centers. So we will guarantee at least a third of the jabs each day. In relation to the overall cost, we are unable to tell at this time. We will give you more information later. Procurement cost, according to what I know, well, since then there is an agreement. I'm afraid that this is a piece of information that cannot be divulged. I would now defer to Professor Chan. Regarding the procurement cost of COVID-19 vaccines, we estimated that we need about $8.4 billion to procure sufficient amount of vaccines for the population. It covers 3 areas. As you may recall, we have a 2-pronged approach. Well, we have COVAX. We have earmarked cost of about 460 million, covering 35% of the population. And under advanced procurement agreement, we estimated that will cost about $5 billion. We have signed confidentiality agreement or non-disclosure agreement. We cannot give you the specific amount. Administrative cost stands at about 2.9 billion. These are all estimates. The actual cost at this moment is unknown. We have asked a number of private clinics as well as healthcare staff from the private sector to work with us. They are our collaborators. They have been actively helping us. We will give them some form of financial guarantee to make sure that the cost for making preparations will be covered. We treat everyone equally. Sorry, speakers off mic. The Chief Executive has already indicated that Well, she herself and chief government officials, principal officials will get vaccinated with vaccines that first arrive in Hong Kong. For the others, it's their personal choice. Last two questions. I'm from Hong Kong Economic Times. I'd like to ask about the vaccination program. For the 5 centers that will open first, where are they? Tomorrow, the first batch of Sinovac vaccines will arrive. How many doses will arrive at the different locations? You mentioned about those above the age of 70. If they're going to get vaccinated, that they can bring 2 people with them. Will there be an age limit of these companions? When do you think the second batch, say for Sinovac or BioNTech, will arrive in Hong Kong? Is there a chance that within this year, non-priority group will get vaccinated? You also talk about sending letters to residential care homes. How many people do you think will agree to get the vaccination? You also mentioned about 10 sizable ones first. When will it start? Will they get Sinovac vaccines or BioNTech vaccines? The other question is about the indemnity fund. Well, there is the 2 million to 2.5 million for the case of fatality and another large amount for any injuries as a result of inoculation. How do they prove it? What kind of documents do they have to supply?
For the Sinovac vaccine, there will be 5 community vaccination centers. For Sinovac vaccines, we will upload the list later. Will be at Kowloon Bay Sports Center, Tin Shui Wai Tin Fai Road Sports Center, and Tung Lou Wan Central Library, and Kwun Chung Sports Center, and Sha Tin Yuen Wah Road Sports Center. For the age 70 or above, when they get inoculated, they can bring 2 other companions, which can also get vaccinated when making the booking. Well, for those under 16, well, there was somewhere out would limit to those under 16 or not available to those under 16 or 18 years old. When the first shipment of vaccine arrives, we will liaise with the supplier. The shipment will arrive in batches. The time of arrival should be able to sync with the immunization schedule. For the 5 groups, as they involve over 2 million, for the first few months, they will be vaccinated. We will monitor the actual implementation after the program is launched, where we can make adjustment accordingly. However, this is our rough estimate at this point. For the RCHD and RCHEs, we have chosen 10 sizable residential homes to provide an outreach service. The Social Welfare Department will issue a letter next week inviting the residential homes to seek the residents and their family members' consent, as well to invite them to indicate a preference for each vaccine. While we need to issue the invite next week, as we need to provide the vaccine information and the information note to attach them in the invitation letter, which allow them to make an informed consent. Upon receiving the materials, which 1 out of the 10 is ready will be vaccinated first. As the Sinovac vaccine will arrive tomorrow, therefore the Sinovac vaccine will be administered first. We expect that it will last till March or mid-March. If everyone reply promptly and agree to it, then we will arrange right away. The preparation work are more or less completed, and these are just the remaining steps. So let me refer to your question on the indemnity fund. I must stress that looking at the data of vaccination around the world, for those with the incidence rate of unexpected serious event or unexpected adverse events is quite low. This fund is to provide public assurance as a precaution. As for your question, under what circumstances that would the public be entitled to this payout? For the affected individuals, they need to fulfill 2 criteria. The actual amount will be subject to the nature of the event and geographical circumstances. The first criteria, for those with the severe adverse event have been validated by a doctor, and the expert committee on clinical events assessment will make a determination. And they will also examine the causal relationship between the adverse event and immunization. As I said, that they would need to be validated by a registered doctor. As a additional measure, if necessary, the affected individuals will be requested to be assessed by a public doctor for medical examination. Last question. On the rightmost. Now news. For the BioNTech vaccine will need to be thawed and diluted before inoculation. For the outreach service or private doctors, will they be only working with Sinovac vaccine? Previously, you claimed that leave home safe was a voluntary requirement, and now you're mandating all premises to scan the QR code. Is it possible that getting vaccinated will become a condition for entering some kind of premises or crossing the borders? And for the scientific committee have yet to meet up to discuss which are the priority groups for vaccination. Why are you announcing the immunization arrangements for the priority groups before letting the experts to meet up to decide? The Sinovac doesn't offer strong protection for the elderly, and yet you put the elderly group as priority groups. Will this decision be changed after the scientific committee meet up later? As for the BioNTech Comirnaty vaccine, due to its cold storage requirements, for a negative 70 degrees fridge to negative 2 degrees, they can be stored for 5 days and need to be diluted into 5 vials and need to be used up within 6 hours. In the process of thawing and dilution, and this could be better and more secure if done in a community vaccination centers. For Comirnaty vaccine, they'll be done in the community vaccination centers. For CoronaVac by Sinovac, this can be done in private doctor's clinic. And there'll be 5 community vaccination centers providing this Sinovac vaccine as well. For the residential homes, well, the Sinovac vaccine will not be a problem, as they will also be arriving first. The 10 residential homes will be getting the Sinovac vaccine first. And at the same time, we'll see that if these residential homes have enough space and the staff to perform the dilution process on site, that if this is possible, however, being slightly complicated. At these residential homes, it might be possible that the BioNTech vaccine will be provided as well. The Sinovac vaccine would not be a problem, and when they first arrive first, I hope that it can be administered ASAP. After inoculation, as for these quarantine arrangement and social distancing measures, and also the premises and requirements, and also on the cross-border traveling, what kind of relaxation or changes will be made, the expert committee will look into it and offer their views. And we need to be science-based and empirical-based in making such recommendations. I'm sure that as the vaccine will offer protection for some quarantine measures and also the restriction on gatherings, I believe that there will be room for adjustment. As for what will be the exact changes and when will it happen, it very much depends on the expert discussion and of their views, and what we will consider from a policy and the administrative perspective. The third question, priority groups. As I said, there are really based on the recommendations by the scientific committees. We're based on the 3 groups of people. Therefore, we have come up with these 5 priority groups, which includes the elderly. As the elderly has always been a risky group, and for the severe conditions after infection, therefore, this is a group that must give priority. In deciding which of the groups to be given priority, the elderly must definitely be included. For before administering each vaccine, for the information note and must be recommended by the expert in the scientific committee before being finalized. The Joint Scientific Committee will meet up within this week. Before the start of the immunization program, I believe that the committee will come with clear recommendations before going ahead. That's the end of today's press conference. Thank you for coming.